Auscultation posterior chest. Ask questions about dry and wet cough, about the color of the sputum. Check vital signs before postural drainage technique. Instruct the person to breathe through mouth little deeper than usual. Listen air sound and differentiate between normal and wheezing sounds. Diaphragm of the chest piece of stethoscope of auscultations. C4 vertebra contains nerves that run through the diaphragm. Usually secretions accumulate in lower segments of lungs. Postural drainage technique 14 to 18 inches elevation from foot side. Gravity assisted mobilization of secretions. Then cuffed up easily. Positioning of the patient with an involved lung segment such that gravity has a maximal effect. 13 to 15 minutes for each position. Gravitational assistance is necessary in non-healthy state to remove secretions. Cupping position of the hand for percussion. Start from lower segments. Middle lobe is not present in left lung. Percussions for losing secretions and then shaking. After session of each position, ask patient to cough forcefully. On position for posterior segments. Supine position for interior segments of the lungs. 2 minutes of percussions and then shaking. Sideline position for middle lobe of the lung to remove the secretion. Usually secretions accumulate in lower segments of lungs and middle segments. Wedge form for the sport. Sitting position of the patient for apical segment. Percussions. You can also nebulize the patient with atom and Ventolin before postural drainage. Shaking. Lean forward for upper lobe. Percussion for 2 minutes on both sides, right and left. Then shaking followed by the percussions. Ask patient to cough forcefully after percussion and shaking.